High blood pressure is an incredibly common health condition, affecting millions of people all over the world. But the drugs that treat it, they're anything but common. They're actually these sophisticated, elegant tools that jump right into the body's complex pressure systems. So let's dive in and demystify exactly how these powerful medications get the job done. So here's what we're going to cover. First, we'll define what high blood pressure even is. Then, we'll take a look at the body's own natural system for controlling pressure. From there, we'll explore the whole arsenal of drugs that doctors use, and we'll break down how the most common ones really work. And finally, we'll wrap it all up with the key takeaways you'll want to remember. Okay, first things first, let's talk about the problem itself. High blood pressure, or what doctors call hypertension, is often known as a silent problem. And that's because for years, you might not even know you have it, all while it's quietly causing damage. So what is blood pressure, really? Well, imagine your arteries are like a simple garden hose. Blood pressure is just the force of the water, your blood, pushing against the inside of that hose. When that pressure is consistently too high, it puts a ton of strain on the hose itself and on your entire circulatory system. And this is how doctors actually put a number on it. You got two numbers, right? That top number, systolic, that's the pressure when your heart is actively beating. The bottom one, diastolic, is the pressure when your heart is resting between beats. As you can see right here, once you start crossing that 140 threshold on top, you're officially in the hypertension stages. This gives doctors a really clear target to aim for with treatment. Okay, so before we can get into how the drugs work, we have to understand the body's own system for managing blood pressure. It's actually a pretty brilliant process, but sometimes it works a little too well. And the star of this show, the main character in our story, is something called the renin-angiotensin system. You can basically think of it as your body's internal thermostat for blood pressure. Whenever your body senses that the pressure is getting a little low, it kicks off this powerful chain reaction to bring it right back up. And at the very end of that chain reaction, you get this incredibly powerful molecule, angiotensin II. I want you to think of this stuff as the body's master pressure raiser. It does a couple of things. It literally squeezes your blood vessels, making them narrower, and it also kicks your nervous system into a higher gear. Both of these things drive your blood pressure way up. So the key thing to remember here is that this single molecule is the main target for some of our most effective drugs. All right, so we've got the problem and we've got the body's own system. Now let's look at the solutions. And doctors have a whole arsenal of medications at their disposal, each one with its own unique strategy for bringing that pressure down. And the cool thing is, there isn't just one magic bullet for hypertension. This variety you see here is actually a really good thing because it lets doctors tailor the treatment specifically to the individual. We're going to focus on the most common classes here to see exactly how they outsmart the body's own pressure systems. Okay, let's really get into the nitty-gritty now. We're going to break down exactly how these top drug classes do their job, looking at their precise mechanisms. Okay, so remember that whole renin-angiotensin chain reaction we talked about? Think of it like a line of dominoes. And what ACE inhibitors do is genius. They just come in and block this one key enzyme right here at step 3, the one that creates our pressure raiser, angiotensin II. They essentially just pull a domino out of the line so the chain can't complete. No angiotensin II means blood pressure comes down. It's a really simple idea, and it is incredibly effective. But of course, no drug is perfect, right? They all have side effects. And for ACE inhibitors, there's this great mnemonic, captopril. The safer cough is the big one. It's the super annoying, persistent, dry cough that actually makes a lot of people switch to a different medication. A couple of others are important too. A for angioedema, a rare but serious swelling, and O for orthostatic hypotension. You know that dizzy feeling you get if you stand up too fast? That's it. It's a lot, but that cough is definitely the most distinctive. So that cough leads us right into the next class of drugs, the ARBs. They're super similar, but with one key difference. If an ACE inhibitor stops angiotensin II from even being made, an ARB lets it get made, but then blocks it from doing its job. It's like putting a shield over the receptor so angiotensin II can't dock and cause trouble. The crucial point is, by working just one step later in the process, they get a similar result, but usually without that telltale cough. All right, let's totally switch gears now to a different strategy, calcium channel blockers, or CCBs. These guys have a whole different target. They go after the muscle cells that are in the walls of your blood vessels. By blocking calcium from getting into those cells, they basically tell the blood vessels to just relax and widen up. It's like turning a narrow, high-pressure pipe into a much wider one. The pressure just naturally goes down. And here's where it gets interesting. Not all CCBs are the same. It's all about picking the right tool for the right job. So a drug like nicardipine is super potent, used for emergencies, while amlodipine is a reliable go-to for just daily management. And critically, some of them also affect how hard the heart pumps, which is why doctors have to be really careful when they're treating patients who have certain other heart conditions. Okay, next up, we've got diuretics, and you've probably heard these called water pills. Their strategy is maybe the most straightforward of all. They work on your kidneys and basically help your body flush out extra salt and water. It's simple, right? Less fluid in the system means less volume in your blood vessels, which directly lowers the pressure. And in this category, the thiazide diuretics are the absolute workhorses. And why is that? Well, they just hit this perfect trifecta. They work really well, most people tolerate them without any issues, and they're very inexpensive. That combination makes them a first-line choice for so many patients. Okay, so let's zoom out and pull this all together. What's the big picture here? Well, the key takeaway is that treating high blood pressure is all about matching the right strategy to interrupt the body's own pressure-raising systems. And this table just lays it out so clearly. You can see the three core strategies we talked about. You can interfere with the body's hormonal command center, you can go in and directly relax the blood vessels themselves, or you can simply reduce the amount of fluid that's inside them. Three really distinct, elegant solutions to the exact same problem. You know, this quote really gets to the heart of it, doesn't it? The higher the pressure, the harder the heart has to pump. That's what this is all about. Ultimately, every single one of these drugs is designed to solve that one fundamental problem, to ease the massive workload on the heart and protect it, and the entire cardiovascular system from the long-term damage of all that pressure. And that really leaves us with a fascinating question for the future, doesn't it? We have all these different tools, all these different strategies. The future of treating hypertension probably isn't just about finding a drug that works, but about finding the perfect drug, one that's tailored to a person's unique body chemistry and the very specific reason their blood pressure is high in the first place.